Hey guys, so today we're talking about haglund'd deformity, or what some people call back of heel pain. Hey guys, it's me, Dr. Nooreen, your resident foot and ankle specialist, and welcome back to my channel. Okay guys, so we're going to get right to it. Today we're going to start off with bringing out Mr. Floppy, which I haven't done in a while, but let's talk about it. So a haglund'd deformity is when you get a bony prominence in the back superior part of your heel bone. So this area right here, when this gets a little bit, when this part of your bone is enlarged, that's what's called your haglund'd deformity. Now you also have your Achilles tendon, which comes down and inserts right here. And then in between the tendon and the bone, you have this fluid-filled sac called the bursa. And the purpose of the bursa is basically to prevent friction between the tendon and the bone. So it kind of acts as a buffer. Now, a haglund's becomes painful usually because people are wearing shoes that are too tight and the back of the shoe presses up against this area, causing the Achilles tendon to kind of rub on the bone a little bit and causing an area of inflammation and pain. And because of that, a haglund's deformity also is sometimes referred to as pump bump or pump bump pain, because oftentimes people wearing high heels with that high heel hugging the back of the heel can aggravate your haglund's, or also just wearing really tight shoes that are tight in the back of your foot, like ice skating shoes and stuff like that. So with the haglund's deformity, all of these areas can become inflamed. The Achilles tendon itself, as it inserts onto the calcaneus, the bursa, and the bone. Okay guys, so what are your conservative treatment options? How do we treat a haglund's deformity? So one of the things you could do is take away one of the things that's causing the pain, which should be wearing shoes with an open back, or wearing shoes where the back of the heel cup is not cupping the back of your heel very tight. So making sure that space in the back of your shoes is a little bit loose and not putting as much pressure on the back of your heel. Now, one of the things that happens is your Achilles tendon becomes inflamed and irritated, and you start to get insertional Achilles tendonitis as well. In order to relieve that pressure that your Achilles is feeling, another thing you do is put in a heel lift so that it decreases the tension that your Achilles tendon is feeling to help reduce that inflammation and pain. Now, the other things you could do are also ice and use anti-inflammatory medication. Now, if the pain is really, really bad, you can also go into a cam boot, which will basically isolate that area and just take all pressure off of it for about 2 weeks. And the other thing you can do if the pain is really bad for you is get a cortisone injection. Now, a cortisone injection is normally not recommended around a tendon because a cortisone injection could cause a tendon to rupture. However, there is a space right over here called Kager's triangle, and I'll throw up an x-ray showing it as well. And what you can do is you can put cortisone right into that little triangular space in front of the Achilles. It'll kind of sit right in this area, right where a lot of your inflammation and pain is coming from, to help calm it down. But if you do get this injection, I personally also put my patients in a cam boot for 2 weeks, and they have to wear that cam boot for 2 weeks while that injection is sitting in there working to decrease the risk of them rupturing that tendon. Now, you guys, once your acute pain is resolved, you have to start doing one of the things I tell you guys to do all the time, which is stretch. Because one of the things that can also lead to the haglund's deformity or that pain in the back of the heel is a tight gastrocnemius muscle belly. Because a tight muscle belly is going to pull on that Achilles tendon, and that is going to cause irritation and inflammation. So once your acute pain has kind of subsided and it's under control, you want to start stretching out those calf muscles. And the key thing is you don't want to do the stretching when you're in that acute pain, because that is just going to increase your pain. But once you're through that acute pain, you have to now address the cause of what's going on, and that would be stretching out your calf muscles. I do have a video about the great stretches you can do for your calves. You guys can check out that video as well if you want to. And the other thing you also do is go to physical therapy so that they can help you work on stretching out those calves. And one of the last things you can do conservatively is massage that calf and heel and really work out those muscle fibers and that inflammation. Now, another thing that can aggravate your haglund's deformity is if you're someone that walks on the outside of your heel. So when you heel strike, and if you're hitting on the outside part of your heel when you're heel striking, that can also lead to irritation and inflammation in this area of your calcaneus. So the other thing that you can do to help stop this strike down motion on the outside of the heel is to wear orthotics, because a good pair of orthotics will force your foot back so that you're heel striking in the center of your heel. So you guys, those are the basic conservative options that you can undergo when you have a haglund's deformity or you have pain or irritation in the posterior aspect of your heel. Now, if all those things fail, you still have surgical intervention. So with surgery, what we do is we detach that Achilles tendon, we'll shave off this bump and then we'll reattach the Achilles tendon. Okay, you guys, that was my video about haglund'd deformity. If you guys have any questions, please leave them in the comment section down below. And as always, you guys, don't forget to stretch and subscribe, like this video, and I'll see you guys next week. Bye.